A very warm welcome to everyone. Thanks a lot for joining us today for this webinar on financing disability inclusive social protection systems. I'm your moderator for today's webinar. I'm Veronika Botzak, Social Protection Policy Specialist at ILO headquarters in Geneva. We'll just wait for a few more seconds because participants are still coming in. And thanks again for joining. I can see the numbers are still going up. It's great. Thanks a lot that we have such an interested audience in today's topic, which is, of course, very important. So maybe I think we have everybody in the room. Maybe we can start with going to the next slide. And I will introduce our distinguished speakers for today's session. Maybe we can go to the next slide so we can see their photos already. First, we will have a welcome address by Dörte Bosse, who is head of the Sector for Horizontal Coordination, Social Protection and Disabilities at the European Directorate General for International Partnerships. I think you will get the slides if you're interested at the end of the webinar. I would like to save our time and not go into too detailed presentations of each speaker. So following the welcome by Dörte Bosse, we'll have an introduction to the substantial topic by Alexandre Cote, who's social policy specialist working mainly on disability at UNICEF. And then we'll have 3 country presentations. Actually, the first one is the speakers on the next slide. So the second presentation will be done by, so the first one is Sovanari Keo, who will present the experiences in Cambodia. And Sovanari Keo is a social policy specialist at UNICEF. And then, yes, if we go to the previous slide, the second presentation will be on Kyrgyzstan by Yasmina Papa, who's social protection specialist for Eastern Europe and Central Asia from the ILO. And then we'll have a third country experience presented by Moussa Chiare on Senegal. And yes, I already introduced myself, so we can go to the next slide. Just a few housekeeping rules. Of course, we hope that you'll have our presentations will spark a lot of interest and questions from your side. Please use the Q&A and not the chat function for posting your questions. That will make it easier for me to go through the questions and in the Q&A session, ask the questions that you have posted. If you're particularly interested in certain questions, you can also in the Q&A vote up certain questions. So if you see other participants ask really interesting questions and you give a thumbs up to that question, it raises, and I can see that this is something that a lot of people are interested in, and this question is more likely to be asked in case we have many questions, and we may not be able to answer all of them live at this webinar. When you put your question in the Q&A box, please also state your name or your organization or your a little bit of context for your question, and also if you want a specific speaker to answer to that question. Finally, you're invited to interact live on Twitter using #SP.org. And with this, I think we're done with the introductory slides, and I will hand over to Dörte Bosse for her welcoming.
Thank you very much, Veronika, and good afternoon, good morning to everyone. Welcome to the webinar on finance and disability inclusive social protection systems. Look, the webinar is part of the EU's global action on improving the synergies between social protection and public finance management, which is being implemented by the ILO, UNICEF, and the Global Coalition for Social Protection Floors. And the European Commission is really proud to be supporting this program, which aims to better integrate social protection and the national budget cycles. So on the program, disabilities, applying a disability inclusive social protection program. This is part of the overall program. Yeah, this has been a target group which has been very important in the design and implementation of the program. We'd say overall, of course, social protection for persons with disabilities is fundamental for achieving their effective inclusion and active participation in society. And by providing essential health care and income security along the life cycle, social protection plays a critical role in reducing and preventing poverty and inequalities and building resilience for all against shocks and crises over the whole life cycle. And poverty gaps between persons with and without disabilities are often underestimated. This has to be highlighted because calculations do very often not take into account the higher costs of living for persons with disabilities. Therefore, to promote universal social protection systems and schemes must be designed to address the specific circumstances of different groups of people and the systems they may face. So let's have a check on how well persons with disabilities are covered. We distinguish, of course, between first dedicated schemes for persons with disabilities, and according to the latest estimations of the ILO, they show that only 33.5% of persons with severe disabilities worldwide receive a dedicated disability benefit. Yeah, and this is to be set into comparison with 47% of the general population benefiting from at least one social protection benefit. So this is about the dedicated schemes. Then secondly, of course, this is about mainstreaming disability and social protection schemes. So this is not doing much better. In most countries, even mainstream social protection schemes are inadequate, inaccessible, or unavailable for persons with disabilities. And as a result, persons with disabilities are often not able to cover the additional cost of living just mentioned, complete their education, and find or keep full-time work. So just checking on the current context we are in, and what does it mean for people with disabilities being covered through social protection. Of course, we do have right now the current geopolitical context aggravated by Russia's war in Ukraine. This is making things more challenging. It is resulting in long-term inflation, causing of food crisis and fueling spikes in poverty and malnutrition. We know, of course, that persons with disabilities are disproportionately affected, as many of them live in poverty. Indeed, COVID-19 saw an expansion of social protection programs globally and improved access to healthcare, but unfortunately, many of those programs were short-lived. And as governments are struggling with the need to tighten budgets right now and reduce expenditures, this program works so that adjustments do not come at the expense of persons with disabilities. And the estimated cost of a basic universal social protection benefit at country level. So we make calculations. This would mean to have universal disability benefit schemes for all would mean that between calculations done by my colleagues here, that 0.17 and 0.8% of the GDP would need to be leveraged to pay those universal disability benefit schemes. Why they are such a wide range? Because it very much depends on the total amount of the GDP. And this is difficult to reach. So coming here to my last point, again, on the program's ambition. So since the inception of the program, it has been very, very clear that the focus is to secure diversified sources of funding for social protection, prioritizing persons with disabilities along with women, children, informal economy, and migrant workers. This is actually the result 2.1 of the program if you look into the programming documents. So beyond financing, the program has worked on several other fronts. So what have we done in the program? First, we looked into a systematic collection of disaggregated data looking into inter alia by sex, age, and disability. Very often we don't have enough data on the target group. We all know this. Secondly, the program has promoted the effective participation of organizations of people with disabilities in the design, implementation, and monitoring of social protection systems and programs. Thirdly, the program has undertaken assessment, disability-specific costs and higher living costs for people with disability. And fourthly and lastly, it has advocated for designing inclusive social protection delivery mechanisms. Before closing here, I'd like to highlight that the Commission, so INPA itself, wherever it does its programs beyond this program here as well, we have mainstreamed in 33.7% of all our programs, we have included disabilities. So we have an extra marker on this as well. This is a very positive result on how we are advancing on the inclusion of people with disabilities. We know, of course, my almost last point here, that the thematic program on social protection and PFM will end in a few months. Yeah, we are very grateful for the work done together with our partners to produce concrete results for persons with disabilities in partner countries. And we'd like to take it from there to further inform our new generation of social protection programs on how to make them disability inclusive. And my very last point here is that I thanked all of you participating here in the seminar, but especially our main implementers, partners, ILO, UNICEF, and the Global Coalition for Social Protection Floors for organizing this webinar and working with us. Thank you very much, and I wish you a lot of success for the seminar here today. Thank you.
Thanks so much, Dörte, for this excellent introduction, both to the topic and giving an overview of the context in which these activities have been taking place in this SP&PFM program. Without further ado, we will move to Alex, who will delve a little bit deeper yet into this question of financing disability inclusive social protection. Please.
Thank you very much, Veronica, and thank you very much, Dörte, for this introduction. So as Dörte mentioned, basically the situation of persons with disability, I think everybody that is in this webinar knows that they are more likely to be poor, more likely to be unemployed. If we think about children with disabilities, they are more likely to be stunted, more likely to be institutionalized, less likely to finish school or to have ever been enrolled in school, etc., etc. And from a social protection perspective, we can sum up this situation in two big elements. Persons with disabilities and their families tend to earn less, and they tend to spend more than household and persons without disabilities. They earn less because they are more likely to be unemployed. If they are employed or they work, they are more likely to be self-employed, to be in the informal sectors, and to have lower wage than people without disabilities. But if we think also about the discrimination that they may face as children in terms of access to education, they arrive in the labor market in a disadvantaged position. In the other hand, you have also family members, mostly women and girls, who will provide unpaid care and support, and to do so will either reduce or stop working or going to school to provide the support, and this will have an impact on the overall livelihood of the family. With regards to extra expenditure, we know that persons with disability in average have higher healthcare needs, that they face more barriers to access healthcare, and that they are more likely to face catastrophic health expenditure. And we see that we have much better data, I would say, in the last 5 years. And we can see consistently across country that healthcare is really a key issue, a key source of expenditure that are pushing persons with disability in poverty. But in addition to those expenditures, you have the wide diversity of disability-related costs that impact persons with disabilities and their families. And depending on how we calculate those costs and where we put the threshold, we see that, for instance, to raise a child with disability in the Philippines, you have to spend 80% more on this child than a child without disability. If you want to participate on equal basis with the general population in South Africa, you will have to spend something around 4 to 15 times more the poverty line in terms of disability-related costs. Very few people can afford such disability expenditure. So what do we expect from an inclusive social protection system? Universal income security, universal coverage of healthcare costs, universal coverage of disability-related costs, including community care and support services, and doing all that in a way that facilitates early childhood development, education, economic empowerment, and community participation. When we say universal, it doesn't mean everything tomorrow. It means progressively achieve this universal coverage and adequacy. And what's really important is to understand that to be able to provide this income security, this coverage of healthcare costs and disability-related costs, it requires a diversity of benefits and schemes. One scheme will not solve everything. And so we really need to build systems and make the most of every instrument that we have in the social protection system to basically support inclusion of persons with disabilities across the life cycle. I won't detail the scheme that is on the screen. You will receive the PowerPoint. And this is part of a broader guidance that we are developing with ILO and partners on disability inclusive social protection system, which will come out soon. But what is really important is the combination of cash benefits, mainstream and disability specific, in-kind support, benefits that will basically reduce out-of-pocket costs through concession or direct support services, as well as interlinkage facilitation of access to other services. Case management is seen really as a central aspect for persons with disabilities on how we help persons with disabilities and their families to access this package and make the most of existing schemes. So the doctor gave a first idea about the overall coverage. If we just focus on disability-related cash benefit, which for the moment are the main instruments, we see that mainstreaming disability in a regular scheme is not yet done at scale. But we see also that this 1/3 of people with severe disability getting cash benefit is either very strong diversity in terms of region or in terms of level of income of countries. We have quasi-universal coverage in high-income countries and Europe and Central Asia, for instance. But if we look at lower middle income or low income or Africa, we are below 10% of coverage. But one thing that is really important, because sometimes there are confusion, and it's extremely important for financing. It's this element, who actually need disability-related support from social protection. And we heard, like in December, the last report of WHO says 16% of the world population live with some form of disabilities. It doesn't mean 16% of the population of any given country will require disability-specific social protection support. If we look at the best performing countries, they have a coverage of disability-specific support that is around 4%, 4 to 5%. Some country goes higher because they have, I would say, more generous policies in terms of supporting people not only with significant support needs, but broader group of persons with disabilities that have support needs. But if we look for low and middle income countries, we definitely have a target around 3 to 4% of the overall population. And it's very important to have that in mind. The population of persons with disabilities is very diverse, and all of them will benefit from more inclusive and accessible environments, accessible transportation, inclusive services, and so on and so forth. A bit less, but still a significant number, will need assistive technology and maybe rehabilitation to some extent. Less so will require, for instance, personal assistance, sign language interpreters, and significant disability benefit. So it's really important to have this overall overview of who is in need of support. Also, it's very important to see that at different age, the needs and the prevalence of disability differ, and it's the older you get the more likely you are to have a disability, which has an importance in terms of both design of program, but also in terms of costing. Looking at the adequacy of benefit is really an issue. We have a graph now with some of the countries that are really trying to do something, and we see that if we take the relevant poverty line, international poverty line, most of the countries are below. Few countries are doing much better, which means few countries are actually, as Dorothy was saying, in position to start really addressing disability-related costs. And now let's talk about expenditure. And it's really these figures that Dorothy was mentioning, between 0.18 to 0.8% of the GDP in low and middle income countries, is this kind of target that we have. Again, we have in the graph countries that are really trying. And what we see is that actually very few low and middle income countries are spending 0.5% of the GDP. Very quickly, you are getting below 0.02, and most countries are actually far below that. So there is clearly a significant financing gap when it comes to disability social protection. So what can we do to improve financing of inclusive social protection? I think one of the first elements is really getting the right data. And it's identifying persons with disabilities in census and national surveys. We do that much better today, thanks to the Washington Group short set of questions, which has been included in many. And that helps understanding better the inequalities faced by persons with disabilities. Making sure that in any social protection registrant survey, social protection management information system, there are ways to identify persons with disabilities, to basically improve targeting, to plan and cost intervention. And in addition to that, we really need better disability assessment, certification mechanism, and information system. And we'll hear about a very interesting innovative approach in Cambodia. And you need to consult with organizations of persons with disabilities. Numbers don't say the whole story. And organizations of persons with disabilities are the best place to give the broad picture of the situation of persons with disabilities. Then making the most of existing expenditure, adapting existing scheme, prioritization in eligibility determination, using public works schemes to finance the development of community care and support system, better synergy between income security and labor market intervention, as we will hear from Kyrgyzstan. Diversifying source of financing. While most of the money will come from the budget in general and tax finance, beyond the contributory scheme that may have limited coverage in many lower income countries, targeted concession and subsidies, tax expenditure can help. If they are well done, they can offset some disability-related costs, and they put a bit less pressure on cash benefit, for instance, and they are a good complement. Social clause in public procurement can facilitate employment and mobilize private sector financing for inclusion of persons with disabilities. Universal health coverage, health insurance related to coverage, for instance, of assistive technology, which today are quite often in low and middle income countries financed by social welfare or social protection budgets. And when we talk about disability-specific support, there will always be need of disability-specific support, even if mainstream programs are inclusive, for all the reason we mentioned before around disability-related costs and the specific needs of people with disabilities. But we can start, for instance, with child disability benefits, which from all the micro-simulation we have done so far, range between it's 0.09 to 0.1% of the GDP. It's more affordable, it's a good start, and we know that it has a bigger impact because disability in childhood has a stronger impact across the life cycle in terms of poverty and the restriction of participation. Disability allowance, we can start with people with high support needs and progressively expand, etc., etc. And finally, meaningful engagement of persons with disabilities and their organization. We will see from Senegal, getting the financing to scale takes time. and it requires sustained advocacy, which can be achieved only with a very strong ownership of persons with disabilities themselves. So those are really few elements. I think that we are still in the infancy on the work on financing. We learned a lot from the program, and we are continuing to approach this. For instance, we will work on developing better costing tools that are not solely focusing on cash transfer, but trying to take the broader system into account, and that will take time. But without further ado, it would be great to hear from Sovanari about the whole experience of setting a new disability management information system and registration in Cambodia, which provide better data, facilitating targeting, but also enabling policy planning.
Thanks a lot, Alex, for this really great kickoff right into the substance of disability and financing disability related social protection systems. And thanks also for the great audience we have, and for everyone who introduced themselves in the chat. It's really great to see the diversity of people from different countries and backgrounds who got interested in today's webinar. Welcome to everyone again. This is really great. And let's go straight to Sovanari, social policy specialist at UNICEF in Cambodia, who will present the experiences of the EU finance program in Cambodia. Please, Sovanari.
Thank you very much, Jerica. Good evening to everyone from Cambodia. Yeah. I would like to start my presentation by thanking the organizer for the opportunity to share the experiences from Cambodia on the disability inclusive social protection, especially for the disability identification. In Cambodia, in terms of the framework, we do have the Royal Government of Cambodia social policy framework for 10 years, 2026-2025, which open a lot of space for the expansion of the coverage for the social protection for the people with disability. We also have 2021 law on the protection of the right for the people with disability, which fully recognize the rights of the social protection. In terms of the coverage, so far, it's still relatively low, because the disability identification remain an issue till 2021, and then the coverage up to 2022 only 16,800 in terms of the regular routine cash transfer program. With the government launch of the new country program for the poor and vulnerable household during the COVID-19, which also benefit to the people with disability around 71,400 receiving the monthly income for about 2.5 years already. Yeah. And this program will possible extension up to the end of 2023. Recently, we have launched, government have launched also the cash transfer for at-risk household affected by 2022 flood, and also the launch of the cash transfer program for the inflation, during the inflation. And for this program, reach around another 6,000 more people with disability. And for the current cash transfer program for the people with disability in Cambodia will be integrated in the newly established family package program, which integrate the different cash transfer program for the vulnerable group. And this program for the people with disability will double the benefit compared to the current cash transfer program, which align with the recent cash transfer program for the people with disability during the COVID-19. Yeah. And for the family package program is going to be launched soon. Will also a stronger linkage in terms of the referral system, other social services, and also other rehabilitation and care services for the people with disability. And in addition to that, it is in terms of the coverage, it will be increased. It will be increased through this disability identification, because the disability identification can identify more people with disability, which can benefit to the people with disability. In terms of the implementation of the social and rights-based disability identification in Cambodia, this is the digitalized system, and also provide the service to the lowest tier of the local authority at the commune level, and reach more than 1,652 commune and sankat, which is the lower tier of the subnational level. How this identification is organized, it is at the commune and sankat level. They will do the assessment to the people with disability using the social and rights-based disability identification questionnaire, which is cover different elements in terms of the type of disability, ability to perform, and also the environmental aspect, and also the assistance aspect of the people with disability. And the data will be transferred from the commune through the mobile app, and then directly to the verification at the provincial level, and then approved by the Ministry of Social Welfare and Veteran, and then the disability identification card issue for the people with disability. With this disability identification card, the people can also access other different services, not just for the disability card transfer program. In terms of the program for the disability identification, this is the on-demand system, which the people with disability can also access to the local authority in terms of update their status, and also in terms of the mobilization for the new people with disability to participate in this assessment. And in terms of the capacity building for the local authority, we have engaged more than 4,900 commune workers for the identification of the people with disability. And in the future, we also looking into the different level of the people with disability, this system, in terms of identify the severity level, and moderate, and also minor. And the card also issued by different category of the level of the disability as well. Yeah, and the work has been done and achieved so far with the strong collaboration with the grassroots level, also with the CSO and DPO at the local community, to mobilize the people with disability to access to this identification, and also the inter-ministerial coordination and monitoring structure of the government overall. This is the example of the disability management information system, and with the data collection from the local authority will also can be monitored directly from different level of the local authority, and also can be shared with other development partner, other ministry, for the planning and monitoring purpose on the inclusive or mainstreaming disability in their respective program. And then this this system also linked with other identification system in terms of the poverty targeting, which is the able to facilitate the poverty targeting system, and also mechanism to identify people with disability directly linked with the disability identification system that can provide additional scoring for poverty identification of the household, of the poor household, etc. In terms of some key figure to share, we know that in census data 2019, 4.9% of the Cambodian people have is the people with disability, with account around 720,000 of the people with disability. But in terms of the current assessment, we just able to assess the 254,000 people with disability in the DMIS as of February this year. And among those identified people with disability, 94,200 of people with disability already included in the National Cash Transfer Program. And then also having this system in place, it is an opportunity also to support the government in terms of monitoring the COVID-19 vaccination for the people with disability. And in addition to this, the government now finalizing the sub-degree for National Disability Identification System as the national system for the people with disability identification, and will be used as the one data source for the for other stakeholders in Cambodia. Thank you.
Thank you very much, Savanari, for this presentation. Indeed, as I just mentioned in the chat, the new system registered 1.5% of the population in a bit more than 2 years, which is really a very strong performance, and is building the pillar of what is needed to basically cost the development of the system. So that's really something that is quite impressive. I know there is a lot of interest in the Q&A, and then we'll come back to that. Now we really would like to go to Yasmina Papa to discuss a little bit. One of the biggest issues that we face in the development of social protection systems is this relation between social protection and work. Many systems insisting on social protection being for people with disabilities in incapacity to work. And as we have seen, this is something we need to change. We need to really shift this paradigm to supporting inclusion of persons with disabilities. And one of the key elements is really leveraging investment of social protection and active labor market policies. So Yasmina, can you tell us a little bit more about this work in Kyrgyzstan that is ongoing? Thank you very much.
Thank you very much, Alexander, and thank you to the organizers for invitation. Good morning, good afternoon, and good evening to all the participants. I don't know if it's a disappointment or maybe you would wish to rest your eyes, but I don't have a presentation. I will share it after the webinar. I was a bit impaired by the IT technology that has stopped my presentation in the middle and then it crashed. I will recover it and share it with you later on. So we are working on enhancing social protection responsiveness to needs and rights of persons with disabilities, and really focusing one aspect of it on labor market inclusion. Now, let me give you a bit of a background of Kyrgyzstan. Kyrgyzstan invests about 10.3% of GDP into social protection. which is relatively low investment for the middle income country like Kyrgyzstan. However, out of this 10.3% of GDP, 80.7% is dedicated to pensions, be it contributory or non-contributory. Expenditures for sickness and disability is about 1.4%, which, if we go back to Alex's slides, seems quite high. Then we have quite good expenditures on family and children, which is 13.4%. And this seems to be a mix of programs like cash benefits, in-kind programs, and some of the community-based services for families with children, including children with disabilities. Now, when we talk about benefits for persons with disabilities, it's a classical employment-based benefit for persons who acquired the disability during their work age, and then non-contributory benefits for persons who have acquired, who have not worked and have disability, and disabilities benefit for children. Now, average disability benefit in Kyrgyzstan is about 80% of minimum subsistence level. A minimum subsistence level is about half of the minimum, about half of the average wage. So it shows that actually even a minimum subsistence level is insufficient to cover people's needs, and let alone disability benefit. This is why we have persons with disabilities who are not able to cover their disability-related costs from their disability benefits. However, Kyrgyzstan is experimenting with certain issues. So recently, a caregiver benefit has been introduced, and it's, as usual, for mothers of children with disabilities, or for some of the female family members, which in a way supports family income, and in a way it is recognition of the care work and unpaid care work that these women are investing on behalf of the state into raising and supporting children. However, on the other hand, the potential of women to participate in the labor market is a bit hindered by such a benefit, and by the fact that caregivers are expected to spend 24 hours on the job supporting family members, in this case, children with disabilities. Kyrgyzstan has some of the peculiarities in their labor code when it comes to adults with disabilities who wish to participate in the labor market and find a job. First of all, there are some affirmative actions which one might consider a bit protectionist. So if a person with disability who applies for the job with public employment service is referred to the employer, and the employer starts negotiating and assessing whether they are really suitable for the job and whether they have all the skills, and they get the job, they cannot be fired. They cannot lose the job if they do not perform. That's one issue. The second issue is that persons with disabilities work less hours than average workers, and persons with disabilities actually, and employers, do not have any support when mediation is conducted between job seeker and employer, or when they start working at their job. So basically, both persons with disabilities and employer are left on their own to manage the best way that they can. And we are in a situation where persons with disabilities, I would say, are making quite a rational decision to be part of the social protection system and manage the best they can with benefits that they are receiving, rather than registering as job seekers at the labor market, knowing that it is highly unlikely that they will get a job, because more than 80% of persons with disabilities in Kyrgyzstan are jobless. And in case that they get the job, they must face an environment which is not supportive, which does not know how to interact, relate, and where the environment or participants in this environment do not have any support in order to make the best out of employment opportunities. Now, even though there are some attempts, really innovative, to try and support employment of persons with disabilities, this will be very difficult because only 0.2% of social protection budget is devoted to active labor market policies and unemployment benefits. So it is an extremely low share of budget, with a relatively low number of employment counselors who would have to cater for all unemployed who register, and then even a lower number of employment counselors who have some experience of working with job seekers with disabilities. This is why a group of NGOs representing persons with disabilities, the Ministry of Labor, and with advice from ILO, assistance from ILO, have been assessing a pilot project where counselors who are persons with disabilities have been added to existing counselors in public employment services with a specific task to reach out to job seekers with disabilities and to promote their interest and to work with employment counselors. There are interesting experiences with that and issues of mainstreaming and actually financing such a service. The other ongoing discussion is related to employment quota, which is at 5% for public services, for public organizations. For private sector, this norm is instructive. So even with employment quota, there is no enforcement mechanisms to collect possible fines for those who do not comply with the quota. This means that basically the budget for any type of support for public employment services, employers and job seekers does not exist. And interestingly, organizations of persons with disabilities have quite good proposals how to remedy such a situation. The first one is to set up extra budgetary line in the budget. To be clear, once when the fines are collected, they are for the designated purpose. They are not advocating at this point to set up a specific institution to oversee the quota system, because they are aware of the pressure that comes from international financial institutions to contain fiscal space, but also to reduce public administration in Kyrgyzstan. The second, they are arguing that it is possible to organize monitoring audits for the compliance with quota system, which would consist of teams from the Ministry of Labor and from the organizations of persons with disabilities. Now, this seems to be a very interesting scheme because possibly it's also an employment opportunity for persons with disabilities. So this is where we are now, and I will stop here to give you a break from this topic.
Thank you very much, Yasmina, for this explanation. I think really interesting to see these issues of the lack of complementarity, but also some of the possible solution with regards to collecting resources from quota to finance the support to economic participation. And you mentioned the critical role of organization of persons with disabilities. So I would like to go now to Senegal and to ask our colleague Moussa to tell us more about what is happening in Senegal with regards to the Equal Opportunity Card, which is a flagship scheme from the government, and what has been the role of organization of persons with disabilities in trying to bring this scheme to scale. Moussa, the floor is yours.
Thank you, Alexander. Thank you, my colleagues, panelists. I would like to thank the organizer of this meeting. Yes, to start with, I would like to say three main things. The first is person with disability in Senegal estimated between 5.9, that is the national census of 2013, to 15.5 from the World Organization, the World Health Organization. It means that persons with disabilities in Senegal are from 900,000 people to something like 3 million. But it shows also the problematic regarding the data, the limits we are having in collecting the data. The second thing is about, with regard to the UNCRPD, Senegal adopted a Disability Act in 2010, which aims at promoting inclusion of persons with disability. And in this act, we have a very important article, Article 3, that is dealing with the Equal Opportunity Card. The Equal Opportunity Card, what is it? In fact, the Equal Opportunity Card is meant to improve the participation of persons with disability in terms of different aspects of life. In so doing, it enables persons with disabilities inclusion in society. To show its importance, in 2015, the head of state was the one who launched the Equal Opportunity Card. So from 2015 to 2023, right now, I mean 7 years, or something like 70,000 persons of disabilities are beneficiary of this Equal Opportunity Card, which is, let's say, a small number to start, because it's something like 7%. Among those beneficiaries, we have something like 43% women and 57 are men. And then regarding, since, as you know, persons with disabilities are not homogeneous, we are having some different percentages, like for people with physical disabilities, they are something like 50%. And 90% of 17 for people with visual impairment, 9% for people with hearing impairment. But if you consider all of the rest, that is people with albinism, people with intellectual disability, they are less than 1%, which derived from collecting the data, because right at the beginning, we used the Washington Group, and in that questionnaire, you don't have, for instance, information on people with albinism. That's why they are really not here. So what is, what is now the Equal Opportunity Card for? In fact, two main functions when it was launched. The first function was to identify persons with disabilities where they are in the country, to locate them, to know how many men, how many women, how many children, how many people, elderly people we are having in Senegal with a disability. That was one function. The second one is related to access to services. In fact, in the Equal Opportunity Card, we have at least 8 services that are aimed, that are targeted, among which we have healthcare, employment, assistive devices, transport, financial support, among other things, and even personal assistance. So, sorry, now the Equal Opportunity Card, if you consider as the beginning, only 7% of persons with disability are beneficiaries. But not only that, we are still facing some really challenges since its implementation. The first one is that the pace of producing the Equal Opportunity Card is very, very low, very slow. And it is rather related to several difficulties. Can be human resources, lack of human resources, lack of finance, among others. We also identify as limits of this Equal Opportunity Card the fragmentation of institutional coordination. In fact, the Equal Opportunity Card is, managed by the Ministry of Healthcare and Social Welfare. That is where persons with disabilities are located in terms of institution. But when it comes to the other social nets like the social or family allowance or the universal coverage, universal healthcare coverage, these social nets are in a different department. And it is not always very clear to understand the connection. That's why in our advocacy, I will come back to that later, in our advocacy, we suggested that it should be a kind of uniformization of the system to make just one system, the Equal Opportunity Card, and the other social nets regarding persons with disabilities. We also have seen that there is lack of security and ineffectivity of social service services delivered by this Equal Opportunity Card. It means what? It means that there are, among those persons who are having this Equal Opportunity Card, there are still some who think that it's useless for them because they find it difficult to get access to the targeted services. And sometimes one can, for instance, get, let's say, the family allowance for one term or two, and at the third, he does not get the allowance. These are also some limits to me. There is also lack of instability regarding the resources. In fact, resources are human, finance, logistic, and whatever. And to cover the whole country, but to be able to provide each person with disability in Senegal with this card, there is need to really work on resources. And this we mentioned in the advocacy action. Regarding this lack of resources, regarding the fragmentation of institution coordination, what we suggested, and it was one of the key messages of the coalition's advocacy, that is, this equal opportunity card should be, let's say, highlighted like a national program. Because if it becomes a national program, it will be provided with sufficient resources in terms of human resources, in terms of finance, so as to enable social workers to go as far as deep in the countryside and then enroll persons with disabilities. We also, in terms of advocacy, worked a lot together with the coalition in terms of capacity building, because there are many people who are really concerned about the equal opportunity cards, but they are not always aware of people with disabilities situation in general.
Musa, terribly sorry
Yes.
to interrupt you, really, but I'm afraid our time is up a little bit. Is there any key thing that you still need to
Yes,
say,
just to
please?
say that maybe three things. Apart from the national program, we made also a advocacy towards local authorities, I mean town council, and then we even made some commitments during, for instance, the recent local council elections. And on this commitment, we had something like key elements. First, that is, it was up to the candidate to confirm that they will encourage social protection in the local councils. Because most of the time, people think that when we talk about equal opportunity card, it's only concerned the central state, I mean the central management. Whereas town council also at the grassroots have a key role to play. We also, in the key points also of this commitment, there is need also to encourage initiatives from youth, women against, for instance, poverty and unemployment, gender-based violence, among others. We also suggested to create something like generation center in order to address generation gaps and so. But something also very important is to highlight the importance that should be played by the local enterprises, I mean the local private sectors, in terms of financing the equal opportunity cards. Thank you very much.
Thank you so much, Musa, for this really interesting, excellent presentation, and my sincere apologies for interrupting. It's just that we are already 5 minutes over time, and we had really interesting questions that have been asked in the chat. And since we still have 130 participants online following this, I hope that our host, socialprotection.org, will allow us to go a little bit over time. And at least we had 3 really exciting and excellent country presentations that really brought the practice back into our discussion. And I think what we will do, I will try to wrap up the questions, 17 questions that have been asked, and I will give each speaker 2 minutes to respond to whatever aspects they think is relevant. First of all, I think the most relevant question addressed to Alex was this question around financing, and if there is a recommended level of financing as a minimum for disability-related social protection. And then a lot of the remaining questions actually did not focus so much on financing per se, but there was a lot of interest on the whole question, on these questions around disability identification and assessment mechanisms. and in particular, how this community assessment mechanism in Cambodia worked. How can you avoid abuse? How does that link to the social registry, or how do you ensure interoperability with other elements of the social protection system? How does that work in remote areas, especially if you want to digitize the system and bring in also civil society organizations? And what are key bottlenecks there? I mean, there was a suggestion that there is possibly also in many countries a lack of key capacity and expertise, very specifically related to questions around disability. And a really great question, I think, was also this questions of attitudes and perceptions and the extent to which that creates additional barriers. And this was in particular to Musa, but these assessment and identification questions, I think both the Cambodia and Senegal case raised a lot of questions around this. And then finally, there was also a question to Alex again about to what extent can public works schemes actually be used to provide community support to people with disability, and is there any practical experience with this already at country level, and how can this be done, which I think opens another big chapter, and maybe we can at some point organize another webinar on that one. So let me start with Alex again. Was there anything that you wanted to comment on in response to these questions?
Thank you very much, Veronica. Very briefly, I think the sweet number, which also came out from some research from ILO, is 0.5% of the GDP. If we look at some of the best performing low and middle income countries, that's where it is, 0.4, 0.5, 0.6. It seems to emerge really as a solid target. I think with regards to public works, I would refer, and I can share in the chat, a report that was done in South Africa by ILO, looking at the potential and the challenges of using public works to initiate community care and support systems. But we see it really, if we think about India or many countries in sub-Saharan Africa, we really see it as a strong source of innovation that has not been yet tapped. But it's money that is already spent. And I think when we see some of the constraints in fiscal space, we need to explore as much as possible this kind of solution where we make the most of existing resources while progressively increasing fiscal space for persons with disabilities. Many things to say about disability identification. I think we could have another webinar also on this, following some of the webinars we had in the past, because we learned a lot, and I think we are in better position now to say more. Over.
Excellent, thank you. Sarvani, do you want to go next and see if there's anything that you want to add in terms of the experience in Cambodia around disability identification and assessments? Savanari?
Yes.
Yes, please.
Thank you very much, Erika. Thank you for a very good question. I just would like to add on the question regarding to the capacity on the identification. And for the capacity, I think we have a lot of challenges because of the understanding of the disability, like the definition of the disability and disability type. So all of these are still challenges, but we work with the different NGO and organizations and DPO at the local authority, at the local level. And then basically they are supporting in terms of mobilization of the people with disability, and also for UNICEF we support the government in terms of continue strengthening the capacity of the local authority, especially for the focal point for identification, including the regular coaching and also the regular refresher training to them there. And in terms of the linkage and also the future looking for the how this disability identification will link to the social registry, this is also part of the ongoing discussion, and it will be further discuss on how this disability data will then be also one of the integrated element to the whole system of the social registry. Yeah, thank you.
Excellent, thanks a lot. And lastly, Mutsa, did you want to reply anything to these questions?
Yes, maybe just one thing or two. The first thing is that the outcome for our advocacy is first to provide every person with disability in Senegal with an equal opportunity card. And the second thing is to make all services effective. It means in terms of health services, for instance, it is the only one that is effective right now. If you take the example, for instance, of women with disabilities, they can go to hospitals. There are some kits that are free, like when it comes to cesarean. I don't know what the word in English. It is free, but when it comes to the other, thing as a prescription, a person with disability should try and buy the thing. So that is something maybe we can focus on. But especially maybe one thing, it appears that in terms of healthcare, households are even taking care of it in a way, in terms of finance. Yes, that is the key point I would like to highlight.
Excellent, thank you. And I'm so sorry, I jumped the gun. Yasmina, of course, you should have, if I had kept the right order, you should have gone before. But so lastly, Yasmina, please, did you want to add anything?
Thank you, Veronica. Just two things. The first one is on disability determination and the fact that it's so medically focused that people forget that functionality is what needs assessing and the needs for the level of support. From that point on, we can start changing mindsets, because now we see, this is a person from group 3 that needs, for example, in our subregion. And that means that this group of people need constant care and support. We've met many people in group 3. They themselves are saying, we can work, but they are prohibited to work by the labor code. And people perceive them as somebody who cannot do things. So this is, with the determination, we need to start changing things. Thank you.
This is a super important point, indeed, yes. We've gone widely over time. Thank you so much to everyone for your interest and your patience. I would just like to close by saying that one of the questions we've received in the Q&A was also whether there is any guidance to countries for how they can improve their social protection system to better work for people with disabilities. And the good news is that indeed, UNICEF, ILO, and a group of other agencies and partners are working on such a guidance note, and we already have a first draft that we are currently refining. And if you're interested, as one of the next steps, we're planning to have a wider consultation on this guide. It's not yet published because we're still consulting on it, but we could send, as part of this consultation process, this draft guide to you for comments, but also for your own use if you wish. So watch out for this. We will be in touch with you on this guide for countries can strengthen social protection systems for people with disabilities. Thanks a lot for all the excellent presentations and questions and for your interest. Bye, everyone.